Hello, welcome to Microbial World. In today's video, we will be talking about HIV early symptoms in men. These symptoms vary between individuals. However, the first signs of these infections generally appear from the first to the second month. Many but not all of people with this experience, which is the body's natural response to this virus. This is called the zero transmission period. It's during this time that it is crucial to identify if the virus has become high in viral load. If not, it is averagely increasing the risk of passing it on to the next person. And the only way to know how it is going is by getting tested. For the symptom 1, which is fever. The fever is usually one of the first symptoms of HIV. It is often accompanied by other mild symptoms such as fatigue, swollen lip gland, and sore throat. At this point, the virus is moving into the bloodstream and starting to replicate in large numbers. As that happens, your immune system induces inflammatory reactions. The symptom 2, fatigue and headache. The inflammatory response generated by your resistance by the immune system causes fatigue and headache in the individual. Symptom 3, swollen lymph nodes, muscles, and joint pain. Lymph nodes are part of your body's immune system and protect your blood by getting rid of bacteria and viruses. They get inflamed when there is an infection. Many of them are located in your armpits and neck, which can result in pains in these areas. Symptom 4, which is skin rashes. Skin rashes can occur early or late in HIV patients. In some cases, skin rashes can appear similar to boys with edgy pinky mouths. Symptom 5, diarrhea, vomiting, and nausea. Many people experience digestive system problems as a symptom of the early stages of HIV. However, nausea, vomiting, and diarrhea can develop in later stages of infection, usually as a result of opportunistic infections. It is important to stay hydrated during this period. Diarrhea that is consistent and not respond to usual therapy might be an indication of HIV. Symptom 6, sore throat and dry cough. Dry cough that can last for weeks and months without seeming to resolve, even with antibiotic and inhalers, is a typical symptom of early HIV patients. Symptom 7, night sweats. Many people who get night sweats during the early stage of HIV. This can even be more commonly infection related to lack of exercise or temperature of the room. HIV testing is vital for this diagnosis. If you think you have been exposed to HIV by having active sex life with casual sex partner, shared sharp needle scars, had blood transfusion, or involved in bloody accidents, regardless of whether you are showing symptoms of HIV or not, it is important to get tested as soon as possible. How can HIV impact my health? HIV weakens the body's immune system. Without a strong immune system, the body is more vulnerable to opportunistic infections and different types of cancers. Antiretroviral drugs are doing excellent job in fighting against diseases and infections, but without treating the virus HIV. People living with HIV can may be vulnerable to a variety of infections, parasites, cancers, including bacterial pneumonia, tuberculosis, herpes, hepatitis, liver disease, meningitis, and other infections. How then can I reduce my risks of getting HIV? The first is to use lubricated latex condoms every time you have sexual intercourse. When used the right way and every time, they help effectively in preventing the spread of HIV and AIDS, and also protect against many other sexually transmitted diseases. The second is to avoid sharing sharp objects, and if it's unavoidable, ensure to sterilize effectively objects before use. The third, blood screening should be carried out most importantly before blood transfusion. It is important to know your own HIV status and as well that of your partners. Getting an HIV and an STD data is the first step to protecting your health and that of those around you. Stay safe and stay protected. Thank you for watching. Please don't forget to subscribe to this channel right here on Microbial World.